Hey guys, thanks for watching my video. My name's Katie and this is my phase 1 reflection for D161, which is our nursing leadership capstone course, which is the final course. So we finally made it to the final course, you guys. So this is for how the Healthcare Improvement Project meets the competencies that we have in our course of study, which is through AACN and the clinical nurse leadership competencies. So there are various different domains that are listed on the competencies reading material that was provided in our course of study. And I specifically have chosen a couple competencies that I felt were met for my project. So to kind of give some background, if you have not seen other videos of mine throughout the course, my project was revolving around improving a benchmark score of timely pain reassessments, so within 60 minutes of giving a pain medication in the PACU setting, because in the PACU charting on my unit, there is not a hard stop of making sure that we're doing a pain reassessment after giving a pain medication. So that was what my project was revolved around. So my project included providing an educational learning module for all nurses in the PACU setting, as well as providing visual aids on the computers. So those both seemed to have helped in my project, and my project was overall very successful. So the competencies that I discussed in my first part of my ePortfolio was competency 1.3, which was under the domain of knowledge for nursing practice. So I chose competency 1.3 because it talks about demonstrating clinical judgment founded on a broad knowledge basis. So not only did we take foundational concepts from my organization on pain reassessments being done in a timely manner, but also making sure that it was aligned with our accreditation organization, so Joint Commission, and also looking into specialty knowledge of the unit and concepts pulled from nursing education specialists and the nurse manager and just our unit to kind of collaborate and work through what the best way to improve those pain reassessment scores. So through synthesizing current and emerging evidence, we were able to influence a practice change, and then just using those domains to be able to improve judgment and overall nursing clinical cares. The second competency that I chose was under the domain of person-centered care. So that's one of the main values and mission statements for my organization is the patient comes first. So providing person-centered care was necessary through this project, and making sure that each patient that we took care of made sure that their pain was assessed appropriately and reassessed. So communicating effectively and working interprofessional collaboration amongst all the individuals on my project team helped ensure the success of the project, and making sure that we utilized advanced communication skills. So not only did we have in-person meetings, but we had talked regularly through Teams on Microsoft and just in-person informal conversations through a variety of modalities, and utilizing evidence-based practice and person-centered materials, and making sure that the healthcare and overall pain reassessment was provided to patients in a timely manner of being administered medications. We would want to make sure that those assessments were completed within 60 minutes of that administration. So that is how my project has aligned with AACN. Thank you so much for watching my video.